Hello, my name is Haley Pache, and I'm a student at FSCJ in the BSN program, and today I'm doing a presentation on the global applications of AI in the treatment, prevention, and diagnosing of heart disease. So to begin, AI in healthcare has been used all over the world. In some countries, it's harder to access than others. It has been proven to be quicker, more accurate. It has improved communication between healthcare providers and their patients. It has also reduced the cost for patients, and it has improved patient outcomes and satisfaction rates. AI has had a strong impact on the prevention, diagnosing, and treatment of heart disease. Heart disease is very common, and AI has made it have less mortality rates, and also has kept people from developing the disease. So to begin, AI has been used in preventing heart disease. So AI tools can be used to prevent heart disease by, first of all, figuring out what people are most at risk for heart disease, and early detection leads to early treatment and early prevention. So some devices that are used are ECG, calcium scoring CT, which detects the calcium in the arteries, specifically for coronary artery disease, chest x-rays, mammograms, and angiographies. So one study that I would like to talk about is from the use of ECG AI. So in this study, they were able to successfully use it in Brazil, United Kingdom, and the United States. Another study that I would like to talk about is, so the AI was able to classify images from an echocardiogram a lot faster than healthcare professionals themselves. And a study was done. There was 230,000 pictures used and being separated into 15 categories. And right here is an image of what an echocardiogram image looks like. Furthermore, AI has been used successfully in diagnosing heart disease. It has been found to be very quick and accurate at diagnosing the disease. The reason why it's so quick is because it has a large data set that it can carry, and it can quickly pull information from these data sets to analyze and diagnose and come up with abnormalities of the patient's heart. And it's a lot faster than healthcare professionals having to do it themselves. So some tools being used, again, are similar to the ones for diagnosing or for early prevention. So CT scans, MRIs, echocardiograms. Specifically with this one, echocardiograms, there has been a study by Dr. Elias. So him and his colleagues used a group of 25,000 patients, and they used the AI tools to predict mortality rates. And they had 15 radiologists that they were doing the study against to see which would be faster, and the AI tools outperformed. And then another study down here was the use of AI as compared to catheterizations and other echocardiogram devices. This one, so the AI was also found to be quicker at predicting mortality rates at those with high filling pressures in their hearts. These charts down here show that the AI had less of a gap of failure than any of the other ones. Furthermore, AI has been used in treating heart disease. It has been used because it's faster at discovering new medicines at treating heart disease. Remote monitoring for patients, so patients can monitor themselves with devices at homes, and it can alert their healthcare professionals themselves. They can talk to healthcare professionals through apps on their phone and also have doctor's appointments on telehealth. There has been uses of AI in surgery, such as placing stents in hearts and also grafts. And then this chart right here, this shows that AI is good at predicting the rates of mortality for those who got the CABG treatment for having a blocked artery. So group B, it was very accurate. The other ones were not as accurate. So this AI device is still needing to be worked on, but it shows that it has worked. And then furthermore, there was another study about whether patients using AI, if they adhere to their medication regimen more than those who don't have AI, and it was proven that 100% of them adhered to their medication using the AI monitoring, rather the other group, only half of them adhered to their medication who weren't using the AI machines for tracking. So ethical and practical considerations. So privacy and data breaches is a big thing. You never know, there could be hackers on electronic devices, people going into your healthcare account and looking at your medical history who aren't authorized to. There can be data biases. So biases as in, so treatment plans that AI comes up with may not be specialized to the person themselves based on their age and race. It could be just a general recommendation treatment plan. So it may not always be best for that specific patient themselves. And then there's also cost in maintaining AI, and then there's also disparities of people not having access because it's too expensive or they just don't have the resources available to them. So AI in different global settings, so it may not be the cultural norm for people to use AI. People want to have autonomy and they don't want to have to use AI to make healthcare decisions for them. They prefer to make their decisions themselves. AI also may not be in their language. It's important for AI to be able to translate information into anybody's language. And then it may not be a part of ethical standards in other countries. One study for AI being used in Nigeria, there was challenges found, and these challenges included the maintenance cost of the equipment, poor transportation and connectivity issues, and the low accessibility is the reason why AI hasn't been working in third world countries. And then here I have a list of all the AI technologies that have been used successfully. And here's a list of my references. Thank you so much for listening, and I hope you learned something from my presentation about the treatment, prevention, and diagnosis of heart disease with AI equipment.